the very upcoming BB Glow treatment. And today, Dr. Manmeet with us will be going ahead to present the a slideshow first, and then she will demonstrate the same on a live patient. So, Dr. Manmeet, please continue. Thank you so much.
Thank you, Dr. Varun. Good morning to all the participants. I hope you are excited for this session. So we'll start with the presentation first, and then we'll go to the patient. Yes. So this is for all the beautiful girls who are here today. So just imagine if your skin is so flawless that it glows, and you wake up in the morning and with a you don't have to do makeup every day, and just you wake up with a no makeup look every day. So that would be a dream for every girl. So BB Glow provides you exactly that. So it gives you a more visual benefit than any other facials, any other treatment, or any other makeup which you are doing. Okay, so it provides you instant, long-lasting coverage. The results and they last you, the results which will be there after the treatment will last you for around 3 to 4 months. So BB glue basically is you can offer patient a way to wear a BB cream or you say a makeup without having to wash and reapply it every day. So what exactly is BB glow? It is a serum which is professionally scientifically proven uh, to hide coverages and to cover all the imperfections on the skin, such as hyperpigmentation, redness, dark circles, and the color which the pigment which is provided over there, it is according to the patient's skin type. So it looks very natural, gives a soft, glossy look to the patient, and it is waterproof and it will last long. So basically, BB Glow is a 100% natural, semi-permanent foundation on the skin, which will give the patient's skin as if she has used a high-end, lightweight makeup. So what are the benefits of BB Glow? You can see instant glowing and radiant skin. There is hydration of skin, reduction in fine lines and wrinkles, reduction in dark circles. You can also infuse antioxidants, vitamins, and anti-aging ingredients according to the need of the patient, because the serums which are provided along with the pigment, they are very patient specific. Okay. So as I was saying, BB Glow provides a very visual benefit. Okay. It is basically a semi-permanent makeup which is there on your face, and you do not have to wash it off daily. And okay, so basically it is you offer patient a way to wear a BB cream without having to wash it daily and reapply daily. So it gives a very clear, bright, and glossy skin to the patient. So what exactly is BB Glow? BB Glow is a serum which is professional, scientifically proven, a skincare product that provides coverage to hide imperfections of the skin, such as hyperpigmentation, redness, dark circles, even acne spots, um, and any other marks which the patient is not happy about. The color pigment formula brightens the skin and gives it a soft, glossy look due to the effective ingredients which are present in the serum, and that is niacinamide and various peptides. And it gives a natural looking makeup base which is waterproof. It will last long. It is 100% natural and gives the patient a look of high end lightweight makeup. So we'll talk about the benefits. The light reflecting pigments, they are macroneedle into the skin, and they help to give instant glowing radiant skin, improves dark spots, open pores, help to even out the skin tone. It decreases fine lines and wrinkles, covers up redness. You can even use it in the patients with rosacea. And other benefits are that when you microneedling the pigment and the serum in the patient's skin, it will help to produce more collagen, leaving the skin looking more plumper. And also, collagen regeneration will lead to uh, skin tightening and reduction in the fine lines and wrinkles. So, who are the best candidates for BB Glow? Patients with dull and even skin texture, freckles, patients with hyperpigmentation, post acne, pigmentation, or scarring, patients with early signs of aging, And also the most important thing is patients with realistic expectations. Because one thing which we have to counsel the patient is that BB glow has a cumulative effect. One sitting is not enough to give the patient the desired result. So you have to counsel the patient in such a way that what you deliver and what the patient is expecting should not have much gap in between. So the patient which you choose should have realistic expectations out of the treatment. Now, what are the contraindications of BB glow? Patients with active acne, atopic dermatitis, any known systemic disease or allergies, and patient who has done any recent cosmetic treatment on this, any kind of facials, any kind of bleach, any parlor activities, or any in clinic treatment on the face, at least a gap of 15 days should be given before doing a BB glow treatment. Also, after doing BB glow treatment, you should not do laser treatment for at least 1 month. Now, what are the possible complications? These complications are very rare, but you can have allergies and contact dermatitis due to the pigment. Also, post-inflammatory hyperpigmentation is possible. And if we do laser treatment right after the BB glow treatment, sometimes it leads to hyperpigmentation and burning. The pigment can also turn into blue, so color, which will leave a very difficult to treat mark on the face. So you have to be very careful as to how you plan your session, and between the BB glow sessions and the laser sessions, that has to be carefully planned. Now this is the BB glow starter kit which you will be getting. So here, as you can see, there are various serums. These the colored ones are the serums which have different function, and you can choose according to the patient's requirement. And here are the various colors which you will be getting. This you can get it customized according to your area, whatever skin tone mostly you get in your city wherever you are practicing. So these colors, as you can see here, are various shades are available in this. Now, what are the booster serums in which you get in this kit? There is this golden color serum, which is a DNA gold serum. It contains PDNR, which is a skin healing activator. It is ideal for skin regeneration and it can be used in any age patient. Then you get this serum, which is whitening stem cell serum. This is ideal for skin brightening and skin lightening. So patients with hyperpigmentation or patients generally looking for skin lightening, this serum can be used. And one benefit or more you have in this serum, that these serums can be used alone also. Rather than using it with the BB glow pigment, you can use them on their own also. Then we have the AC stem cell. This is ideal for patients who have mild acne and acne mass. The AC stands for acne control. So if you are using this serum before the BB glow, so it helps to control mild acne, but it should be avoided in severe acne patients. Then you have the Peptide Gold serum, which is a pink color serum. It is golden color serum. It has 99.9% pure gold powder and 10 powerful peptides. This is ideal for wrinkles and people who are in age of 40 to 35 to 50 age group. The Aqua stem cells is this serum, green color, which is ideal for patients with dry skin. It provides very good hydration to the patient. Now, these pigments which are available, they come in this skin range. This is for Indian skin tone. You can go for darker skin tone also, which are available. So the lighter shades for Indian skin, these three lighter shades which you can see here, this is used as a highlighter under the eye. This two pink serum, this is used on the cheekbones, and rest all from here you can choose whichever pigment matches to your patient. These 5 here, you can choose a color match according to the skin tone of the patient. The last two darker skin shade which you can see, these are used as a contour shade. Now this is very optional. If your patient wants that contoured look, you can give this to the patient. But if you're doing it for a young patient who does not want a very chiseled and who doesn't need a very chiseled and contoured look, you can skip this in those patients. So this is how it is applied. The lighter skin shades are applied right on the eyelid and under the eyes. The skin shade the shade which matches exactly to the skin is applied in dots on the entire face, and the darkest skin shade is applied on the area which you would like to highlight contour, specifically this cheek area, the jawline, and the uh, hairline area close to the hairline on the forehead. Also, you can apply it on the nose. This is very optional depending upon the patient's need. Now, the steps of BB glow treatment, we'll just discuss it in short here and then I'll show it to you on the patient. So first, you have to deep cleanse the skin of the patient. You can, there are facial cleansers which are available with the kit. You can buy it extra, or you can use uh, skin, any face wash according to the skin type of the patient. So this will help to remove any surface debris, oil, sunscreen, makeup, anything patient has on the face has to be thoroughly cleaned first. Then you go for the exfoliating gel. This helps to deep clean the pores and remove the dead skin. Then we use a neutralizer, that is a toner, which is used to re-establish the skin's optimal pH, reducing redness, hydration, and hydrates the skin also. After that, the booster serums are applied. This custom serum you can choose according to the need of the patient and is applied using a nano needle to boost the effects of the BB Glow serum, which will be applied after this. Then we applied the BB Glow serum, that is the pigment, which is selected according to the desired shade and infused using nano needle technology with the help of a derma pen. After this, we apply a hydrating mask over on the patient's face for 10 to 15 minutes to avoid the drying out of the pigment and also providing hydrating and soothing effect to the skin. Then, some things which you should remember while you're counseling the patient, that BB Glow is a semi-permanent makeup. So it is only enforced in the topmost layer of the skin, so it is not going to last for long. Patients will need to come back for follow-up sessions, which can be according to the patient, 3 months or 4 months, but patient will need a follow-up session. BB Glow serum is made out of natural ingredients, so the serum particles do not last very long in the skin, and this is beneficial for the patient's skin also, as it is not going to harm the patient. And these serums are chemical-free, fragrance and paraben-free, so it is not going to harm the skin of the patient. The results of the BB Glow are cumulative. With each session, you will see a visible improvement in the skin tone and texture. So you need to give multiple sessions to the patient to see the desired result. And also, there is no downtime. The results are immediate and tend to improve with any consecutive session. So usually there is no downtime, there is no redness or any marks on the patient's face, so they can resume their work immediately. So now we'll go to the post-treatment care. So like all other beauty treatments, to make the effect last longer, so you require proper maintenance and aftercare. So you have to advise patients to avoid hot baths and saunas, avoid excessive sun exposure, especially on the first few days, avoid using of harsh soaps, scrubs and makeup for at least 24 hours. So these are the some before and after pictures. Excuse me. So as you can see, in the first session, you can still see some blemishes in the patient. But after the second session, these minute pigmentation here on the nose, which was visible after the first session, is also covered up. So when we do a third session, whatever is left, little pigmentation which is left here will also be covered. Next here, you can see this is a little darker skin patient who has very uneven skin tone. So this is after one session where you can see a significant little change here and significant change in the cheek area and a little change in the darker areas. This is after the second session. The skin is relatively lighter and even. This patient will require more sessions so as to achieve the desired result. Thank you. So now we'll be moving on to the demonstration of on the patient.
Yeah, one of our doctors had this question that can the steps be taken back again? So I told her that you will be explaining the steps one by one on the patient itself. So, this is the kit which I was talking about. So here you have all the serums and the pigments which are available for the patient. So for her, I will be doing this serum, which is whitening stem cells, since she had some pigmentation on her face. So this is the best serum which we can use for her. And first, we'll be starting with cleansing her face. So you can take any face wash which is suitable for patient's skin. We start with cleansing. Next, we are going to use a toner. Whichever toner is available with you, you can use that. So this is the DermaPen A6. So you can use whichever DermaPen is available with you. Dr. Varun, I'm audible? You are audible. Okay. So we'll start with the procedure. So here the main important is the strokes which you are using. So when you start, so since this is with nano needles, it is not painful. So you can adjust it 2.5 on the cheeks. You can adjust this to 1, and then just go in rotating movements on the skin. As you can see, she's very comfortable. I have not numbed the skin. So go in rotating movements. On the nose, you can go vertical. Which dermapen are you using? I'm using A6. And are these the nano needles, no, over this? Yes, this is a nano needle. I'll show you the needle after this. Okay, ma'am. So this serum dries out, so you have to do it really quickly. You can't wait with this. So once you are happy with the infusion, with all the areas of the face has been covered, then we can move on to the applying the pigment. So for her, I have chosen the darkest shade which is available in this kit. So it is this shade. I'll be taking it out on the syringe again. So you can see I've taken only 0.5 here. So this will be enough for her. So this procedure, I'm just doing it to show you, but you can also keep it ready when you're planning a patient. You can keep it ready beforehand also.
Then this lighter pink shade, we'll be using it as a blush on her cheeks. So this I've already taken in the syringe. So now we'll be applying this. Just go push the plunger slowly, otherwise everything is going to come out at once. We just apply in dots like this.
Ma'am, there is an important question coming up
Hmm.
that how would we determine which shade of the serum to use for which skin?
The
As
shade.
this one looks quite light for her skin.
Yes, this is a little light for her. But I'm going to mix another shade with this because I do not have the exact shade. So I'm going to mix one more over here. So you have to if you don't have the exact shade, you can mix two shades and customize. So this one is the lighter. It's okay for her highlighting her lower eyelids. But for the rest of the face, I'll be using one more shade.
Okay, ma'am. Thank you, Dr. Parinita, for your question. Ma'am, Dr. Rajat is asking that what is the quantity of serum which is required for the full face?
Point 0.5, 0.5 ml. I've taken a 2.5
Point
ml.
five.
In this 0.5 ml was the serum which I used for the entire face. You can take more if you feel that the patient's skin is very dry, or since she doesn't require much, I gave her little. But if you feel that the patient's skin is very dry or she has a lot of fine lines and wrinkles, you can use more also. One ml is enough.
Dr. Anuj is asking, is this also good for dry skin? Can we go ahead?
Yes, you can go ahead for dry skin also, but there is a serum which is specifically for dry skin. Use that serum first, and then you can go. Of course, if the patient has atopic dermatitis, seborrheic dermatitis, or any other skin condition, then please avoid it. If it is just a dry skin, then you can use it. You can always judge
Dr.
history
Yes,
from
ma'am,
the.
please continue.
You can take patient's history. If patient has any skin disease, then avoid it. If there is no contraindication, then you can go ahead. Dry skin per se is not a contraindication for this treatment.
Okay. Ma'am, Dr. Vamshi is asking that will there be any visible side effects after one session?
Side effects? No,
Sorry,
there no.
visible
There can
changes,
be
visible changes,
visible.
changes
Right.
or
Yes.
effects.
Yes, there will be visible changes. You will start seeing even skin tones. If on this patient, if you see she has some, this her forehead area is darker than the rest of the face. Then she has darkness around the lips. So for this patient, after one session, you will be able to see changes in her cheek area and her upper lips and nose. But this forehead area will be slightly lighter. There will be not much visible difference. But with consequent sessions, you will be able to see the difference. So if a patient is
Dr.
relatively has even skin tone and is a little fairer, then you get result in one session. So it depends on the
Okay, ma'am.
facial, the skin type which you are doing. Okay, I'm adding
Ma'am,
another.
Dr.
Yeah,
Swati is asking from Kerala that will it help in facial melanosis?
it will help you some out in melasma. You can cover up melasma if a patient has any
But not
function.
melanosis.
It will cover up, but it will the number of
Okay,
sessions will be more.
will be increasing.
Yeah. So I'm taking another shade here and
Okay,
I'm
ma'am.
putting it on the skin. So you can just go closer to her wherever you have put the other shade. So I've put two shades in order to match the skin tone. After this is the pink shade which we had taken. So I'm going to put it on her cheek area. As you can see, I don't know if the camera is picking up. This is very pink. Can you see? So this is going to act like a blush. So just apply it only on the area where you would normally apply the blush. So next we are
I'm
going to
not.
now.
Okay, ma'am. Please continue. I'll take the questions later on.
Yeah, just let me finish this, otherwise it's going to dry up.
Sure, ma'am. Sure. Thank you.
So just see how the movement of the derma pen is going on the skin, on this cheek area. You have to go in a circular motion. As you come near the jawline, on the jawline you have to go in horizontal and vertical motion, so that you drag down the pigment a little over the cheek chin area also, and you can go on the neck area also if you want to. Basically, you have to match the face and neck. I'll start with the under eye area. When you're doing near the pink pigment, just make sure you don't drag it down. So when you're doing this, just do it on the cheeks. Don't drag this pigment down or up, so that it doesn't, the blush effect doesn't come on the other area. So 2 to 3 passes on each area is enough. See, now you lift the pen and then go down here and start mixing the other two shades also. Now you can drag this pigment wherever you feel like you are doing, wherever your pen goes, you can drag the pigment there. This is just like when you do micro needling in derma pen, the strokes which you use, this will be similar. So when you're on a jawline, I like to do it this motion, then pull down the pigment below the jawline. Neck पे करें. Maybe I'm not doing on the neck, so this is just for demonstration. So I'll just do it here and show you. Okay.
Ma'am, is it only in the circular motion on the cheeks and the jawline has to be different motion for the movement?
You can go in circular motion, but then see, when I'm just see here, when I'm doing in circular motion, my pen is, can you see the pen is just
Yeah.
going down on her neck? It's just hitting
Yes,
her
ma'am.
neck. So
Hmm.
this, if you go in circular motion, you will miss out the area, and also you will hurt the
So,
patient because you're just suddenly going on her neck. So just go in
okay, ma'am.
this, or in horizontal or in vertical motion when you are doing near the jawline, so
Okay,
that
ma'am.
cover all the area.
Thank you, ma'am.
See, now this pigments I've mixed. Okay, I've been able to reach not exactly her shade, but very close to her shade. See, this is why you have to have a kit which has shades for all skin types, especially whatever type like is more common in your area. But if you
Ma'am,
don't have the exact skin type, you can always mix two colors and make the shade. Yes, Dr. Varun, you were saying something.
don't we have to use the serums on the nose part is missing, I can see.
Yes, you have to do it on the nose also.
Okay, ma'am.
I'll be doing on the nose also. Don't worry.
Okay, okay, ma'am.
See, I have the pigment which I had used under the eye. I just dragged it onto the nose also.
Ma'am, how many minutes does it take to, do the entire this thing?
10 to 15 minutes, you can go 2 to 3 passes in each area.
Okay. And the speed, ma'am, the way you are using it, the speed is okay, or we have to slow it down sometimes?
If the patient is comfortable, then don't slow it down, because
Okay,
this
ma'am.
will, yeah, while you do it, you will be able to feel it that the pigment is drying up a bit. So you're not being able to drag it everywhere. That, see, speed is according to your comfort level. Okay, if you're very comfortable, your speed can be faster also. If you're not comfortable, you're doing it for the first time, you can go slow also. See, now I'm taking, when you're going for the upper eyelid, don't go in from this side. You always have to go in from the outside and then come inside. So here also don't go in rotating movement, just very slowly, just do this wiping motion over here. Don't go on the eyelid, you can go on the bone here. So this can be used for your dark circle treatment also. Now you can see the difference if I wipe this off. Can you see the difference between both eyelids?
Yes, ma'am. Evident difference.
So here this is covered up quite a lot of her pigmentation, and here you can still see the pigment is still there. So since you will obviously need one or two more sessions. Now see here you can see the pigment has already dried up. Now I am not being able to pull it up. So this is why you have to go a little faster. This will come with time. The
And
speed
can
which
ma'am
you have
make
to go.
some the serums you can mix again and make it more watery again?
Yes, yes, you can do that. But I have already given enough passes here, so I'm not going to do that. Okay, see here I have left the pink pigment. I finished up everything. And now at last I'm going to do this one so that it doesn't mix with other pigments because I don't want anywhere else for the pink color to show up. When you're doing the procedure, you will start seeing changes. So you will be able to judge when you have to stop. You will start seeing a little redness. Now see, okay, can you see?
Yes, ma'am. The redness is good. A good
Yes,
sign, ma'am.
yes, yes. The redness is good sign. You will be able to judge when you have to stop. So if you start
Okay, ma'am.
seeing redness or you start seeing the pigment has dried up or it's getting absorbed, then you can stop doing this
Dr.
procedure.
Sabha is asking, ma'am, the speed can be varied into this Dermapen A6, right?
Yes, yes. You can vary the speed. You can also vary the depth of the needle which you are using. You can adjust that.
Ma'am, what speed you are doing it at?
This is not the speed. Okay, I am doing it at 1.
Okay, that's good enough.
That's good enough for pigment
Okay, ma'am.
penetration. If you want, you can go up to, if the patient is comfortable, you can go up to 2, 2.5. So now this is done. So I have covered up the entire face. So now I'm not going to wipe this off. I'm going to give her a mask.
So meanwhile, how many sessions, according to you, this patient will be needing?
I didn't get you. Sorry. What were you saying?
Sorry. How many sittings, according to you, ma'am, this kind of a patient needs? How many sittings to show evident results?
She will require 5 to 6 sittings.
Okay. And ma'am, what was the depth of the needle you were using?
I was using nano needle, and the depth which I had set here on the derma pen was 1.
Okay, ma'am. Thank you.
Okay. So if you want, like for her, 1 is enough. But if there are patients who have wrinkles like deep-seated or fine lines or any more pigmentation like melasma and all, you can go up to 2 also.
Ma'am, and can the normal saline drops be used to make it again watery and prolong the procedure?
You can, but I would prefer to use the serum.
And ma'am, what was the name of the serum which was used in the starting?
For this patient, I have used whitening stem cell serum.
Whitening stem cell. Okay, ma'am.
You have other options also, as I showed earlier. So you can choose this according to the patient's need.
Thank you, ma'am.
Okay, for this,
And I would think, ma'am, the topical anesthesia is not required in this settings because the nano needles are not going deep inside, right?
okay. So here you can ideally we can use a biosilk mask, but that is an extra consumable which you have to use with this patient. You have to buy with the kit. See, otherwise, if you don't want to invest in that, you can use these sheet mask also. This is hyaluronic acid sheet mask, and this is aloe vera sheet mask. This is
Thank
aloe
you, ma'am.
vera moisturizing. So since she is a young patient, she doesn't need an anti-aging mask. So I'll be using this aloe vera mask for her.
Ma'am, one question was coming. We don't need anesthesia, right, in this for topical
No,
anesthesia?
no, I have
Yeah.
not given anesthesia to her, and she's very comfortable.
And on the because the needles are not, I saw the needles are not going that deep inside. That is the reason, right?
I,
It is working superficially.
Yes, just let me apply the mask, and I've already opened it.
Yeah, sure, ma'am.
I will show you the needle.
Okay, ma'am.
If
Thank you so
you
much.
want to see the difference between two needles, I'll do that also.
Please, ma'am. Thank you so much.
So any good sheet mask. कोई प्रॉब्लम तो नहीं हो रही ना? So you can even spread the serum. This mask has a lot of serum, so you can just spread it. And then you have to
Uh,
leave this on minutes. Okay, so now I'm going to show you the needles.
Ma'am, and what is the gap between the two sittings?
Uh, 2 weeks to 4 weeks, depending on the need of the patient.
Okay.
If the patient
In
doesn't
how
have,
long?
there is any function she wants to attend or any wedding she wants to attend, you can do the minimum gap of 7 days.
And how long the results last, ma'am?
One session will last you 2 to 3 days, but if you've done 3 to 4 sessions, it will last you around 3 months. Okay, I'm just I'll come back to the patient after 10 minutes.
Okay, ma'am.
Okay. Okay, I think
Meanwhile, we
I've
can take
got
some
out from
questions.
my other ID, so we'll continue with this only.
Yes, ma'am. So meanwhile, we can take some questions and see the needles.
Yeah, see, this is a nano needle. Okay, I'm opening a new one. So once you have used a needle, you cannot use it again because it becomes dirty. You have to throw it. So I'm taking out a new needle. Okay, Himanshu is asking me to join again from the laptop.
Please.
Is it comfortable here? Then I can
Yeah,
continue
we
here.
are comfortable, ma'am. We are comfortable.
Okay. So see, this is a nano needle. If you push this, I'm pushing it out. Can you see there are no needles here?
Yes, ma'am.
Okay, it is very plain. So it is not. It is the needles are very small. It's not painful. See, I'm rubbing my finger. It's not painful at all. Okay. Then I have a 12 pin needle. This also I'm going
Ma'am,
to
the
show you.
video quality is deteriorated a bit.
Yeah, on the phone it will. Okay, I'll join from the laptop again.
Yes, ma'am. Now it's very nicely visible. Thank you so much.
Okay. So I'll show you the needle again. So this is the nano needle. As you can see, this doesn't have any needles in this. I mean, the needles are there, but then they are not so big that it's going to hurt you.
How many the number? Can you tell the how many number of needles are there in this?
Nano needle doesn't have a number. It has circles and
Okay.
it has squares. Okay, so this is a square. This is a circle needle.
Thank you, ma'am.
The numbers will be there when there are the longer needles in this. I'm going to show you another 12 pin needle so you can see both of them side by side. So, can you see the needle?
Yes, ma'am.
This is a 12 pin needle. So here there are needles. They are longer. This is the nano needle. See the needles, they are flat. So it's they are different and it's not going to hurt the patient. So you don't need to put any anesthesia on the patient.
Ma'am, the nano needles can be used with any derma pen.
Yes, you will need to
Okay,
give
ma'am.
at least 3 to 4 sittings to each patient. Sessions
And
can go this.
ma'am, Dr. Paranita is asking that, ma'am, can the 12 needle be used or this for this procedure or only nano needles should
No,
be used?
no, only nano needles because with 12
Okay.
needles you will be piercing the skin. You will be putting the pigment in deeper layers. You don't want that. This pigment should be only on the top of layer. At the
And Dr.
end,
Rajat Mehta,
whatever you're doing, this is a foundation. This has pigment, so you do not want to put them in the deeper layers.
okay. Ma'am, Dr. Rajat Mehta from Panchkula is asking that how many days prior to any occasion the session is needed like a wedding or something, like a bridal thing.
If a patient, depending on the of the patient first, so if you have a patient who doesn't have a lot of pigmentation, 2 sessions are enough. So you can start at, like 2 weeks prior to her function. And if a patient
Okay.
like what we did today, if she wants this, so she has to start a month before.
Okay. Can Dr. Uma Kiran asking that can we use this night depigmentation creams and serums after this treatment in the night?
Yes, you can give that. Normal
Okay, ma'am.
skincare which you are giving to the patient can continue. Only thing is avoid doing any procedure, especially lasers on this patient for at least a month after you've done the last session.
Dr. Hitesh from Delhi is asking that any specific consent forms for this procedure? Do we have to take that?
There is no specific consent form, but the general one you can get it signed from the patient. That is always good to do for any procedure. But there is nothing specific for BB glue.
Uh, okay. And ma'am, what are the good brands for BB Glow kits? Like we know about the Stevie, which is coming. And so, what are the any other brands which is manufacturing this, and we can the other can procure?
There are brands, but I don't like them. I've seen one more other brand, but I did not like the quality of the material, and there are many fakes available for this. So whenever you're buying, buy it from someone who is reliable, who will not
Okay,
give you
ma'am.
a fake product. And but
So you can, we can provide you. You can test it down, and then we can give it to our people.
okay, that's okay. But the company which I've showed you today, this is the best.
Yes, ma'am. Stevia is the best.
It is the best.
Ma'am,
Don't go in for it's not expensive. Don't go in for anything else.
how much did it cost you this Stevia kit, if we can ask?
This kit has cost me 10,000.
Okay. I mean, so ma'am, it ranges between 10,000 to somewhere between
It
that.
cost me 10,000 because I got like multiple kits together. But if you buy one, it is going to cost you somewhere around 13 to 14,000.
Yeah, one friend of ours took it in Kerala, right? A few days back. It costed him 13,500 rupees, one kit.
He must have taken a single kit.
Yeah, ma'am, only because of
I got
bulk buying
multiple
is
kits.
not feasible right now because of the COVID situation. Otherwise, we
Mm.
are getting it for a flat price of 6,500 max. We're trying
Bulk
to,
is always better. You get a very good
we,
price at a good
yeah,
price.
we'll go about more than 100, 200 kits. So I think the cost should come down to 6,000 somewhere.
That's good. Then I should purchase from you only.
No, no, ma'am. You will get a yearly subscription from us, from Dermas for doing for us. And you've taken out your time, and given this free session to everyone. So, ma'am, I will thank you for that. And I'll take some final questions and then we will see the patient and we will get over with this. And, ma'am, after Dr. Uma Kiran is asking that the mask you were using, where they are available and the price range, if you can share.
The mask I've gotten, this is from MTS Meditech company. They
Okay.
have various ranges, and per mask is around 100 rupees.
Oh, that's good. Very good. Ma'am, again, the a question from Dr. Uma Kiran is after 3 to 4 sessions, results are gone, or they do last for 3 to 4 months.
They last for 3 months minimum. Also
Okay.
depends on patient's aftercare also. If the patient is not doing proper aftercare, it's not going to last. So if
And
there is proper aftercare, it will last you for 3 months.
ma'am, one kit lasts for how many patients according to you?
10 patients, 10 to 12 patients. Because there is slight
So,
wastage also because थोड़ा सा वो needle में रह जाता है.
okay, ma'am. Ma'am, Dr. Sakshi is asking how to time BB glow if patients are also on sessions chemical peel, and what would be the interval between the two?
If once you do the chemical peel, you're shedding off the topmost layer, and this pigment is in the topmost layer. So once you do chemical peel, the effect is gone.
Okay, ma'am.
So you have to space it. Like if you're doing it in before a function, at least 15 days gap होना चाहिए. Like once you have done a chemical peel, do any procedure after 15 days. It's similar with this. And after doing BB glow, if you are planning for subsequent sessions, don't do a chemical peel in between.
Okay. And ma'am, what is the aftercare you will advise in these?
You have to avoid any hot baths, saunas, even hot showers,
Okay.
and for at least 3 to 5 days. And no scrubbing of the face, no makeup
Okay.
for at least
Ma'am,
24 hours.
which face wash do you recommend? Not the brand. What
Mm.
the content of the face wash you recommend for this?
For this, I would recommend something very mild, cetyl alcohol,
My.
cetaphil types, anything. And if the patient
Okay,
has
ma'am.
mild acne, you can add salicylic acid, but that not regularly. Like once a week, you can use salicylic and rest normal face wash. Very
And ma'am,
mild and gentle.
many doctors have this question that there is also a exfoliating gel which comes with this to
Yes,
cleanse and do we use that a lot or is it easily available? What are the things to discuss over
it
that?
is easily available if you get it from the vendor. Like not very easily, not openly available, but yes, with the vendor it is available. But if you're apply using like I use the salicylic acid based face wash with this patient, so you can skip the exfoliator also.
And on the gap between the sessions, can you just please answer one more time? The gap between sessions of particular patients?
10 days to you
Okay,
can go up to 4 weeks, depending on the need of the patient.
okay. And ma'am, which of the medicated cosmetic treatments can be done after glow?
After this,
Yes, ma'am. After BB glow?
after 15 days, you can go in for you can do a hydrofacial, you can uh,
Okay,
avoid chemical peeling and avoid lasers. Absolutely avoid lasers. Other than that, you can do anything.
okay, ma'am. So, ma'am, most of the questions have been taken. I request everyone to, quick send me some last questions, last 2 to 3 questions we'll be taking with ma'am, and then we'll see the patient. And thanks, ma'am, for all her time and energy. And it was, according to me, it was a very wonderful session. I may be biased because I am doing it, but as a learner, as a student right now, I have learned a BB Glow for the first time, and I think ma'am has done a lot of justice and answered every query very nicely for us, and the procedure steps and the presentation was superb. Thank you so much, ma'am. So we will
Thank
take
you.
some last 2 to 3 questions and then
Okay.
we will thank you. Ma'am,
Okay.
how to manage any immediate complications if any Dr. Chandi is asking from Andhra?
Yeah, if you have, you can have a contact dermatitis or you can have an allergic reaction. Both of them can be controlled with steroid ointments. And if it's very severe, you can give steroid orally. But till now, very severe, I have not seen any complications yet. But very severe complications are very uncommon. Still,
Okay,
if there is an unfortunate event, topical steroids can manage it.
okay, okay, ma'am. So, ma'am, that is for it today. We have answered all the questions very nicely. It was a great session from you, and thank you for sparing out a Sunday for us specifically. And
Okay, there is one question Dr. Hitesh is asking.
yeah,
He is asking me if I can take an hands-on for him. Definitely, Dr. Hitesh, if you are willing to come down here, I can take an hands-on treatment session for you also. I don't mind taking hands-on. So if you're comfortable coming down, I can do that.
okay, ma'am. So we will plan. We will launch this also. That if anybody is interested to come to down to Ludhiana and learn from you, we will encourage them to go ahead with that. And Dr. Hitesh is thanking you a lot. He's mute right now. Everybody is mute, and many messages are coming. Everybody is thankful. We will take a, poll for this also. Not a poll. We will post it down to our Facebook group, and I will request everyone to, whatever comments are coming onto the WhatsApp group. I will request everyone to share those comments on the review section on the Facebook group, because others should also know and people should come forward, because we in the starting we had a 256 group and increasing every day, but at the end of the day we got successfully done for 54 candidates over here. So for a start, it is a amazing thing we have done. We again thank you, Dr. Manmeet, for arranging this session for us on a Sunday specifically, and we thank all our attendees for this. And we hope to again ahead with this program to help many other dermatologists around India learning this procedure and be Atmanirbhar, as I say. Thank you so much, ma'am. Again, thank you, Dr.
Thank you.
Manmeet. Thank you all.
Okay, Dr. Varun, you've missed one important question which I was seeing here. Uh, there is someone has asked about acne patients.
Yes, ma'am. You
One is
already told acne patients this procedure cannot be done, so I didn't
yes,
take up.
active acne. Please don't do any. This
Yeah.
procedure is going to flare up the acne. Mild acne, melia you can do. On post-inflammatory hyperpigmentation also you can do.
Okay. Ma'am, can we just see the patient once after we remove
Yeah.
the mask?
Yes. And also one more question: if patient is on laser hair reduction, can we do BB globe treatment? You can do it after the laser hair session is over. After doing BB glow, please do not do any kind of laser on the patient. The pigment is going to turn black or blue and it is going to look like a tattoo, which is very difficult to remove. So any kind of laser is absolutely no after doing BB glow treatment, at least for a month.
Ma'am, Dr. Anuj, last question Dr. Anuj is asking. He's a very close aside and he has been helping us a lot. And the last question is like any fixed drug eruptions can be, used to mask by this procedure? FDs?
No, if it is a no, FD pigmentation is very deep. It is
Okay,
not
ma'am.
going to penetrate so deep.
Okay. Thank you so much. Thank you so much, ma'am. Again, I'll request all the participants to, when I'll share the link, please give your reviews on the session. Dr. Manmeet will be, it will be very nice. And to, it's always nice for the organizers and the presenter to read such nice comments. And whatever your reviews are, not if even if we had a glitch somewhere, the quality was not good, or the voice was breaking, something or the other, because we need to improve, and if we get together, we can make it even a more better successful session next time around. So thank you everyone. Thank you, Dr. Manmeet, for this wonderful session. We will take your leave. Thank you so much.
Okay, there is Dr. Anjali is asking, please answer this, ma'am. Uh, if patient is not happy with color, can we use exfoliating gel for removal? Uh, yes, you can. It is anyway. One session is going to come out after two. The effect is going to go after 3 to 4 days if the patient is not happy. Okay, so you don't have to worry much about that. Any salicylic based acid face wash you can give to the patient and it's going to be okay.
Couldn't get you.
There was one question by Dr. I think Dr. Anjali or Dr. Swarni. They're asking, please answer this. The question was, if patient is not happy with color, can we use exfoliating agent for removal? So if you are doing the first session and patient is not happy, then you can yes, you can give an exfoliating gel. This is not permanent; it is going to come out. Okay, now can we go and see the patient, or we want to stop
Yes, ma'am,
here?
please. No, no, ma'am, please. We will see the patient and then we will let everyone
Um,
go.
please allow me to join from the my phone, please.
Yeah, please, Himanshu, please allow.
I'm going to remove the mask. Just massage it with a very light hand. And whatever extra is left, just wipe it off. Can you see the difference? See, her cheeks are looking
Yes,
much more
ma'am.
softer.
The
See, it's looking
pigmentation
much
is
more
also improved.
softer, brighter also. Yeah,
Yes, ma'am.
pigmentation. Can you appreciate the change in pigmentation?
Yes, ma'am.
See, even her forehead is lighter now. It's not a match, but then it's lighter.
It's obvious, ma'am. This is which number sitting for this patient?
This is her second session.
This is a second. There is a lot of improvement in the second session itself.
And one more session is going to be good enough for her.
And ma'am, if we could go on the forehead part, and I think there will be a lot of improvement, right?
Yes. Her forehead is also much lighter than what it was before. But
Okay,
then
ma'am.
yes, this area will require a few more sessions. You can also do, if you're happy with this area, if you're happy with the cheek area that you've already achieved what you wanted to, then you can next session you can avoid this area and just do the forehead and the chin area. So this won't get more lighter, and you will be able to maintain that balance between the skin tone.